Welcome to Marian Ayurveda. In our first episode, we are going to discuss a condition called autism. Autism was not a word we were very familiar with in the past. But today, through the media or among the children of our close friends, we see that this condition is increasing among many people. If we look at foreign countries or Arab nations, the number of cases is much higher there. Why does this condition occur? What are its fundamental causes? Is there anything Ayurveda can do for this? I would like to talk about what effective treatments are available for this. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. One, about the disease, the authority I have to speak about this is based on the fact that I have been working in this field as a doctor for the past 11 or 12 years with both experience and clinical practice. I have worked as a specialist autism doctor at various autism centers at that level, whether it is with patients or with children. Through close interactions with them and through their parents, these are the experiences I wish to share with you in this episode. First of all, for those who don't know what autism is, let me briefly explain. As our children grow up, they may have reduced social interactions, may not play with other children, may not be able to play together. They might be isolated, engage in self-play, or when we ask them something, they may not respond back. Some of the characteristics include repeated behaviors, like always picking the same book, book one, or if they have a toy, playing only with that one toy, or there may be certain repeated manners or actions or rest movements. These are all some of the unique features of autism. So since we only know up to a certain extent, I won't go deeper into that. What I want to focus on in this episode is that even though a definite cause for this condition has not yet been identified, I am sharing here some information that we have gathered from our experiences. The first thing that comes to my mind based on the experiences of several children I have seen is that quite a few children, in the beginning, some of these children used to talk or recite rhymes, but over time, they lost those abilities and gradually shifted to a completely isolated state. This is something I have often observed, and it has deeply surprised me, because at one point these children were quite capable and talented. But after some time, as they grew older, they began to show autistic features. So when I took the history of such parents or such children, what I understood was that a child who had been developing well suddenly gets a fever. After the fever, the child's speech ability or social interaction starts to decrease. Why does this happen? Ayurveda has a specific theory about this. This is what I have been able to understand more deeply in children with autism, as explained in Ayurveda. If we get a fever and it is not properly treated, Ayurveda says that it can spread into different organs of the body. Otherwise, in Ayurveda, this is called Datugata Jwara. For example, let's take the case of COVID-19. When COVID-19 came, at first we had a fever for a few days. After that, the fever subsided, but then a persistent cough starts. This virus has a unique characteristic. It tends to stay longer in the lungs. So the real reason why the presence of this virus does not leave our body is that the cough associated with the corona infection, or as a part of corona, continues for us. There are quite a few people who, after getting corona, experience sleeplessness or develop depression or have a fear of death. This means that the presence of the coronavirus is in that person's brain. This is exactly what we can observe even when it comes to autism. And for example, a child, say at 1.5 years old, gets a fever. The fever actually changes the temperature and all that. But if the presence of this fever localizes in the child's brain, then his brain functions start to shift towards what we call autism. The child becomes unable to think or act as before. In this way, the child changes. After that, the child starts to develop autistic features. So if you ask what is the one thing we need to look at from a treatment perspective here, just like how we handle post-COVID cases after corona, we treat post-COVID cough in the same way as we treat corona itself. It's exactly the same. What we do for such children here is, for these children who developed a fever at 1.5 years old, that since the causes are still present in that child, we treat the fever just as we would normally. But for an issue that has affected the brain, we make some modifications in the medication. When we treat our child with these medicines, many of the lost abilities can return. I would like to share the experience of a child who came in recently. This child never used to combine two words and would never answer when asked a question. For example, if you asked, "What is your name?" Like children with autism, instead of answering, they would just repeat the question, "What is your name?" That's exactly what they would do, just repeat it. So this child, now when asked their name, the child says their name. In that way, as the child grows, what the parents mentioned is that now the child has started to combine 2 or 3 words and speak occasionally. I feel that is the progress. The success we talk about is the result of the treatment given earlier. Improving these so-called brain functions and at the same time eliminating the presence of the disease that affected the brain is what has brought about such a significant change in this child. So this is what we call the first stage. Another stage which I have often noticed occurs in the parents. If parents are extremely anxious about allergies, what happens is that the child quickly develops autistic fears. This is another thing I have noticed. Most of the time, when I talk to parents, these parents themselves have very strong allergies. I have often observed that children born to such parents have a much higher chance of developing these kinds of conditions. For example, out of 11 children I know, 1 child is autistic. Because of this, some parents are now afraid to have another child. In such cases, I would say that you never need to be afraid. What we definitely need to do is for the parents to undergo treatment first. Whatever symptoms or conditions the parents have, if we can treat those symptoms or address the underlying causes, such as energy imbalances, completely, then after the parents have completed such treatments, we can ensure that the risk of having an autistic child is minimized as much as possible. So if you ask why this energy imbalance occurs, it is mainly due to the excessive consumption of spicy, sour, and salty foods. This is what significantly increases allergies in a person. Alternatively, mental stress is another factor. So allergies arise mainly from these two causes. Once we regulate such dietary habits, the second reason I have observed for autism is as follows. It is something that comes along with us for treatment. If it's not for a third reason, then it's not a third reason. For various reasons, I've often felt this way. For example, once some parents came, during their working hours, they would leave their child with the maid and go to work. They would only return at around 9 or 10 at night. Yes, until then, the child is always watching cartoons with the maid or running around outside. The child is constantly exposed to cartoons, and this is being allowed to happen. In this way, the child's processing capacity is being lost. In such cases, we haven't been able to observe any symptoms of allergies or fever. So in such individuals, we can see that nowadays there is an excessive influence of media, which we are all aware of. To feed children or for other reasons, people turn on the TV or give them a mobile phone. And this is done so that mothers, due to being busy with work, can keep the children occupied with cartoons, which gives us temporary relief. But we have noticed that children are significantly losing their social skills because of this. Similarly, the absence of a parent or a loving presence, someone to sit with them or play with them, not giving them a kiss, not showing affection. This is sometimes called instant parenting. That is, parenting without a language of love and compassion is a major reason. Similarly, children's eating habits nowadays, lots of cheesy foods, chocolates, or foods that increase carbs, these diets quickly reduce the brain's functions. The excessive presence of chocolates and biscuits increases carbs. The presence of such foods increases carbs in the brain. So this doesn't happen just because of one factor. There are 3 or 4 components involved, and sometimes it feels like 11 traumas. Along with that, the lack of affection and the overwhelming influence of media are also significant factors. When diets that include nuts or foods containing chemicals are added to this, even with just these 3 factors, there is a much higher chance for children to develop autism, even without any other illnesses. So these are just the basic reasons. There are still many more reasons, but what I have shared here are the 2 or 3 most important reasons that I have observed. Now, moving on to the treatment for this. When it comes to this treatment, I usually divide it mainly into 2. One is autism itself, autism, and after autism, as we know, mental retardation, the kind of issues that occur in children with brain dysfunction. One thing we can say for sure is that if there is brain dysfunction, if the brain hasn't developed properly, it is absolutely impossible for us to change that. Many parents run around to different places and in various ways, losing a lot of money in the process. Let me make it clear right from the start that all we can do is manage the situation. The second type of children, which we refer to as pure autism, are those who do not have any structural abnormalities in the brain. We are able to treat and help children in this category to a considerable extent. Even among children with pure autism, I personally divide them into 2 types. One thing I always observe is the forehead temperature of the children. That is, when we touch their forehead, it feels extremely hot. At the same time, if we touch the rest of their body, like their hands, there is no such heat. If these symptoms are present in such children, they have a better chance. That is, the likelihood of autism recovery or the possibility of them gaining more and more functions is higher. The reason, as I mentioned earlier, is the fever or temperature affecting these children in autism. It is this that has impaired their brain functions. Therefore, if these children have a high forehead temperature, we can understand that there is an internal fever present. When giving Ania's medicine, we see a drastic change in the children. So, if such a change occurs, I feel more confident that there is a good chance for significant improvement in the child. At the same time, after a certain stage, 3 to 5 years, or from around 2 years old, or even from 1 to 1.5 years old, these children may show signs of this fever. After some time, the presence of this fever or the forehead temperature may be lost, which can last up to 5 or 6 years. We get about 4 to 5 years. After these years, if the forehead temperature disappears, our chances are reduced. then it becomes difficult for us to bring about further improvements or to address their hyperactivity. That's all we can do. So if someone still has forehead temperature, if the person's forehead is warmer, there is a good chance for better results and improvement. So when we provide Ayurvedic treatments to such individuals, one thing we must pay attention to is that if we perform oil-based therapies like pouring oil, dara, on them, there is a very high chance that the condition could worsen. This is the first thing we need to understand. Instead of performing oil dara or similar treatments, when the head is hot, the main focus should be on treatments and internal medicines that help reduce the heat in the head. By administering medicines that are taken internally, we can eliminate the fever or heat inside the head. Only after that should we proceed to panchakarma treatments. This is one thing I feel strongly about. Similarly, when there is no temperature on the forehead, what we should do is, as I mentioned earlier, follow those 3 things and switch to light food. My wish is still that even when children have a fever, we should not give them foods that are hard to digest. Likewise, the loving care of parents is also very important. When such medicines are given, there is a possibility of significant improvement in these children. The next stage is what we call chronicity, that is, treatments for the symptoms seen in individuals whose autism has progressed for about 10 years or so. One such symptom is very high hyperactivity, excessive anger, and similar issues. For all these, Ayurveda has very effective internal medicines as well as panchakarma treatments. The medicines I use include Tamara, Iriti, Makan, and others like Ramachan, which help cool the head. When the head is cooled, the children become calm. They even start to sleep lying down. Treatments like Shirodhara and the medicines applied to the body all help to calm the child. There are also medicines administered through the nose. After completing such a stage for management, we do something called Vasti. Vasti refers to an internal enema. When this is given, we have observed improvements in brain functions. As they reach adolescence, we encounter another problem in children. This is mainly a significant issue that they face. Aspiration is the issue here. Whether it is institutions run by the Autism Institute or parents themselves, I can speak from my experience working at the Autism Institute. There are quite a few girls who are being cared for now, but they don't really know what they are doing. So how do they directly face this? The biggest crisis was this: how to avoid aspiration in children. Once a mother said, "What else should I endure, doctor? I can bear everything for my autistic child, but..." When taking the child to functions or on the bus, because of these kinds of behaviors, they end up hitting the child. That is the deep pain they shared. When these children enter adolescence, the pain they experience is even greater than autism itself. For all of that, Ayurveda offers very effective and beautiful treatments. Now, the medicines we prepare, there are about 11 special medicines that we combine and make, which are very effective. These are all effective treatments. So up to a certain extent, this is a great help for our parents. I always say, from what I have understood about these children so far, when it comes to their diet, we should give them food that is not too spicy and significantly reduce foods that are too sour, as well as biscuits, chocolates, or bakery snacks. Then give them plenty of love and care. Once they receive proper treatment, we need to understand that there is nothing wrong with their brain or communication abilities. There is just some specific metabolic error, or perhaps a problem that affects brain functions more than a typical metabolic issue. From what I have understood, the issues these children face are often due to some infection or fever, as I mentioned earlier, or something similar. So if we provide the right treatment for this, up to a certain extent, or let me put it this way, if we are able to diagnose and treat it at a very young age, say around 2 or 3 years old, we have been able to bring about drastic changes. We can see this again in another episode as well. Thank you.